So we had particular issues that we needed to look at and address at Imperial College within our cancer service, and we had reported poor patient experience through the National Cancer Patient Experience Survey, and we needed to assess the role and function of specialist nurses with the responsibility in cancer for that patient experience. And so we wanted to look at how we could enhance their role, provide a more structured workforce and supported workforce. So we brought all the specialist nurses under one umbrella within the cancer performance team, and being managed and led by myself as the Trust Lead Cancer Nurse. And when I said to my nurses, I want you to be much more patient focused, have a nurse-led services, nurse-led clinics, be very responsive and accessible to patients. They said, yes, we'd love to do that, that's great, but we haven't got capacity in our job plans. I said, okay, what could we take away from you to make this work to meet some of those objectives? And they said, well, we do a lot of admin, we do a lot of responding to calls, a lot of callbacks. And so I said, if we could take those away, would that enhance the role and allow you to be much more clinically active with patients? So that was the plan. Of course, we work very closely with some of our sponsors, the main one being Macmillan Cancer Support, and so we were already in a collaboration and partnership with them. So we proposed that we would like to start a different way of working, and they were encouraged by some of the other successes or marginal successes we'd had in various projects and the marginal gains we were making in our patient experience. So the clinical nurse specialists wanted to gain more time in their working week to enable much more clinical focus and being clinically active with patients. So with the collaboration with Macmillan, we developed the Navigator service. There are similar models in America, not necessarily with cancer patients, but with managing patient pathway with ANC support. So we developed the Navigator role. Macmillan also recognised that we needed an increase in establishment from our nurse specialist perspective, and as we had problems recruiting, we were unable to recruit internally. We wanted a model of being able to grow our own, give some career sustainability and progression for the nurses that worked with us. So we developed some new Band 6 development posts across the tumour groups, some additional Band 7 clinical nurse specialists, and we within the team uplifted a number of posts so that each team or cohorted team of nurses actually had a team leader. So we created an element of you can start at a Band 6 and progress your way up to become a team leader. More latterly though, we've actually enhanced the upper level by creating some nurse consultant posts. So nurses who have got a PhD or are working towards a PhD, we've been successful in securing funding through Macmillan to internally promote a number of the nurses in the team. And if we had more who were studying at that level, then we would also consider whether we could uplift those senior posts in a similar way. So the results of doing all that, we have a call centre which actually enables our ANC staff, our navigators, to be the first point of call for patients. So that takes away the burden on our specialist nurses to respond to what are very often non-clinically related questions or queries from patients. Many patients would ring up and say, I don't know when my appointment is, or I was told I would have a CT scan and I don't know when it is. And so the clinical nurse specialist will be spending a significant amount of time addressing those non-clinical queries. The result of that is that we've enabled our CNSs to develop nurse-led services, nurse-led clinics, some innovative work throughout the various different teams, which we would have been unable to do previously. One of the things that we very quickly learnt was that the navigators needed to be fairly closely linked with the clinical teams, especially the CNSs, although we actually see the navigator service as a patient service rather than a clinician service. And those, our learning from that is that we've now brought the navigators under the umbrella of myself as the Trust Lead Cancer Nurse, and we've employed a supervisor. And the key aspects of their particular role is to have very focused and consistent education and learning for those individuals, and that we have regular touch points with them to ensure that they are okay with what they're doing, the problems that they might be addressing. We've instigated some clinical supervision for that team, because they can receive in any 1 month up to 1,600 calls per month. Of course, those calls previously were likely to have gone through either a medical secretary, but more likely through their clinical nurse specialists. We've instigated an education programme for our clinical nurse specialists that is building a community of practice within their services, and so our 55 CNSs are educated through a pathway that we've developed locally, but that also relates to the previous framework developed by the London Cancer Alliance. And our success is really measured by the number of vacancies we do or don't have in the team, by our ability to respond to some of our network targets on completion of holistic needs assessments, and also the National Cancer Patient Experience Survey and the results of that, which come annually. And we've made some significant gains over the last 2 years since we started looking at role and function of our specialist nurses in a number of fields that we particularly relate on that survey to specialist nurse working. So to date, we're very pleased with the results that we've had from this development, and we now move forward to looking at living with and beyond cancer and workshops and initiatives associated with that.